The image most people have of a heart attack comes from movies and television. A person suddenly grabs their chest, struggles to breathe, collapses dramatically, and everyone instantly knows what is happening. But that familiar scene has created one of the most dangerous misunderstandings in modern health. Many people are not saved because they do not recognize a heart attack. They are lost because they are waiting for it to look exactly like the version they have seen on a screen. A person feels something unusual happening inside their body. Maybe there is pressure in the chest, a strange discomfort, unusual tiredness, nausea, or a feeling that something is simply not right. But because they are still standing, still talking, and not experiencing the dramatic pain they expected, they convince themselves it is something harmless. They tell themselves it is indigestion, stress, a muscle problem, or just exhaustion. Then they wait, and those minutes of waiting can be the difference between saving heart muscle and losing it forever. I'm Dr. John Meyers, an internal medicine physician with 15 years of experience, and one of the hardest lessons I have seen repeatedly throughout my career is this. People often lose the battle against a heart attack before they ever reach the hospital. Not because medicine failed them, not because doctors were too late, but because they spent the first critical moments hoping the problem would disappear. Here is something every person should understand. When a heart attack begins, your outcome is often decided during the first 10 to 15 minutes. Those moments happen before emergency doctors see you, before you enter a hospital room, and before any advanced treatment begins. The actions you take during that short window can dramatically change what happens next. There are 3 specific things that can help protect your heart during those crucial minutes. One action helps you get professional treatment faster. Another can slow down the process that is damaging your heart. The third reduces the stress placed on a heart that is already struggling for oxygen. These are not complicated medical theories. They are simple actions that anyone can remember. But knowing them before an emergency happens is what matters. Because when fear takes over, people do not suddenly become experts. They follow what they already know. And before you think, I already know the answer, you just call emergency services. Stay with me for a moment. Yes, calling for help is the first step. But many people make serious mistakes even after making that call. Some wait too long before calling. Others try to drive themselves to the hospital. Some take actions that waste precious time because they misunderstand what is happening inside their body. The goal here is not to make you afraid. The goal is to make you prepared. Because the day this happens, whether it happens to you or to someone sitting beside you, you will not have time to search online for answers. You will either remember what to do or you will freeze in uncertainty. My purpose over the next few minutes is simple: to make sure you already have a plan. For years, I have focused my work on helping people stay healthy, independent, and active as they grow older. I have seen too many people slowly lose their quality of life because they ignored warning signs or never learned the simple habits that protect their bodies. Your heart does not suddenly fail in a single moment without warning. There are usually signals. There are usually opportunities to act. Understanding those signals and knowing how to respond can give you a much better chance of protecting the life you have built. To understand why these 3 actions matter, you first need to understand what is actually happening inside your chest during a heart attack. Once you understand the process, the reason behind every step becomes much clearer. Your heart is a muscle. Like every other muscle in your body, it requires oxygen to survive. The oxygen it needs comes through a special network of blood vessels that sit on the outside of the heart. These vessels are called the coronary arteries. A heart attack happens when one of these arteries suddenly becomes blocked. In most cases, the blockage comes from a blood clot. The process usually begins quietly over years. Fatty deposits, often called plaque, build up inside the artery wall. At some point, a piece of that plaque can crack open. When that happens, your body reacts the same way it would react to an injury anywhere else. It tries to protect you by forming a clot. Normally, clotting is a life-saving process. If you cut yourself, your body creates a clot to stop bleeding. But inside a coronary artery, this protective system can become dangerous. The clot does not repair the problem. Instead, it blocks the passageway and stops blood from reaching part of the heart muscle. And when that happens, the clock begins. The heart tissue beyond that blockage is no longer receiving enough oxygen. A muscle without oxygen cannot continue working normally. The longer the blockage remains, the more heart muscle begins to suffer and eventually die. There is one sentence I want you to remember above everything else. Time is muscle. Every minute that artery remains blocked means more heart tissue is at risk. The damage that occurs during a heart attack is not something you can simply reverse later. Dead heart muscle does not grow back like a cut on your skin. Once it is gone, it is gone. That is why every decision during those first moments matters. The question is not only, can we save the person? The real question is, how much of the heart can we save before treatment arrives? 3 major factors determine that answer. The first is how quickly the blocked artery can be reopened. The second is how much the clot continues growing while the person is waiting. The third is how much stress and workload the heart is forced to handle while it is already struggling. And here is the encouraging part. You have influence over all 3. That is what these 3 techniques are designed to do. Each one targets one of these problems directly. One helps restore blood flow faster. One helps slow the clotting process. One reduces the pressure placed on the damaged heart. Remember those 3 goals, and you will remember the entire plan. Now, let me tell you about someone whose story I think about every time I explain this. I'll call him Howard. Howard was 66 years old. He was retired, independent, and the kind of person who never wanted to make a big deal out of anything. He was not someone who complained easily. If something bothered him, he usually ignored it and moved on. One morning around 4 a.m., Howard woke up feeling something unusual in his chest. It was not the dramatic, crushing pain he had seen in movies. It was more like a heavy pressure in the middle of his chest, almost as if something was sitting there. His first thought was simple: heartburn. He took an antacid and waited. But the feeling did not disappear. His left arm started aching slightly. He became sweaty and felt a little sick to his stomach. Still, because he was not holding his chest and collapsing like the people he had seen on television, he convinced himself it was probably nothing serious. He did not want to wake his wife for just indigestion. So he sat down in his recliner and decided to wait a little longer. That decision changed the rest of his life. By the time his wife found him later, he was pale, sweating, and clearly very ill. By the time they reached the hospital, almost 3 hours had passed. Howard survived, and I want to make that clear. But survival does not always mean the same thing as recovery. During those hours, a significant amount of his heart muscle was permanently damaged. The part of his heart that was lost was never coming back. Today, Howard lives with the consequences. His retirement looks different than he imagined. He manages heart problems, takes multiple medications, and gets tired doing things that once felt effortless, including something as simple as walking to the mailbox. And the hardest part is knowing that his story could have been very different. Because later, I cared for another patient with almost the exact same warning signs. The same type of mourning, the same dangerous symptoms. But the outcome was completely different. The difference was not magic, it was not luck. It was what happened during the first few minutes. And that is why recognizing a heart attack early matters so much. Because you cannot respond to something you have already convinced yourself is not happening. Most heart attacks do not begin with a dramatic collapse. They begin quietly. The first sign is often discomfort in the center of the chest. But many people do not describe it as pain. They describe it as pressure, squeezing, tightness, heaviness, or a feeling that something is pressing down on them. Sometimes it comes and goes. Sometimes it spreads. It may move into one or both arms, especially the left arm. It can travel into the jaw, neck, back, or even the upper stomach area, and that is exactly why so many people mistake it for digestive problems. Then there are the other warning signs: a cold sweat, shortness of breath, nausea, dizziness, unusual weakness, or sudden exhaustion that does not match what you are doing. These symptoms are the real face of a heart attack. And there is something especially important that many people need to hear. Women often experience heart attacks differently than men. Their warning signs may be less obvious. Instead of dramatic chest pain, they may experience shortness of breath, nausea, jaw discomfort, back pain, or an overwhelming fatigue that feels completely out of proportion. People with diabetes also need to be especially careful. Diabetes can damage nerves, including the nerves responsible for sending pain signals. That means someone with diabetes may have a heart attack with very little pain or almost no obvious warning. Throughout my years of practice, I have seen too many people delay getting help because symptoms did not match the picture they had created in their mind. So remember this rule. If something feels deeply wrong with your chest, your breathing, or your upper body, and it does not go away, treat it as a heart problem until a medical professional proves otherwise. You can recover from calling for help and discovering it was not a heart attack. You cannot recover from waiting too long. There is another important distinction that everyone should understand because people often confuse two different emergencies. A heart attack and cardiac arrest are not the same thing, even though one can sometimes lead to the other. A heart attack is mainly a plumbing problem. A blood vessel supplying the heart becomes blocked, but the person is often still awake. They may be able to talk, explain what they are feeling, and ask for help. Their heart is still beating, but part of the heart muscle is being deprived of oxygen. Cardiac arrest is different. That is an electrical problem. The heart's rhythm suddenly becomes abnormal, and the heart can no longer pump blood effectively. The person collapses, becomes unconscious, and is not breathing normally. A heart attack can trigger cardiac arrest, which is one of the reasons every minute matters so much. But the first three techniques I am explaining now are designed for the situation where the person is still conscious and experiencing warning signs of a possible heart attack. The first technique is simple, but the way you do it matters. Call emergency services immediately. Yes, you have probably heard this advice many times before. But hearing something and truly understanding why it matters are two completely different things. The purpose of calling is not just to get transportation to the hospital. The purpose is to start treatment as early as possible. Many people think the real medical care begins when they enter the emergency room. But in a serious heart attack, the treatment process can begin much earlier. When paramedics arrive, they can perform an electrocardiogram, commonly called an ECG, right where you are. They can check the electrical activity of your heart, identify signs of a heart attack, and communicate with the hospital before you even arrive. That means the medical team can begin preparing before you reach the doors. The hospital can activate the cardiac response team. Specialists can be ready. Equipment can be prepared. Instead of starting from zero when you arrive, the process is already moving. The goal during a major heart attack is to restore blood flow as quickly as possible. Many hospitals work toward reopening the blocked artery within a specific time window after arrival. Getting emergency help quickly is what makes that possible. But there are two mistakes people make after symptoms begin, and these mistakes are responsible for losing valuable time. The first mistake is waiting. People tell themselves they will give it another 5 minutes. They think maybe it will pass. They worry they are overreacting. They do not want to bother their family, call an ambulance unnecessarily, or feel embarrassed if it turns out to be something minor. But I want you to understand something clearly. Emergency professionals would rather respond to a situation that turns out to be harmless than arrive after a person has already suffered preventable damage. That is their job. The embarrassment of making a false alarm lasts a few minutes. The consequences of waiting too long can last the rest of your life. The first hour of a heart attack is also one of the most dangerous periods because the heart can suddenly develop a deadly rhythm. In those situations, the heart may stop completely. An ambulance carries equipment that can immediately respond to that emergency, including a defibrillator. If you are sitting at home waiting, that equipment is not beside you. The second mistake is trying to drive yourself to the hospital or allowing someone else to drive you. This may seem reasonable. Many people think, I can get there faster myself. But this can create an even more dangerous situation. Imagine your heart rhythm suddenly becomes unstable while you are driving. You could lose consciousness behind the wheel, putting yourself and others in danger. Now, one emergency has become two. In the back of an ambulance, you are not simply being transported, you are already connected to emergency care. The safest move is this. Sit down. Call emergency services. Clearly say, I think I am having a heart attack. Those exact words matter, because they immediately communicate the seriousness of the situation. The dispatcher can prioritize the call and guide you through what to do while help is coming. Do not minimize your symptoms. Do not say, I just have some discomfort. Do not say, I think it is probably nothing. If you believe your heart may be involved, say it clearly. I think I am having a heart attack. Then stay on the line and follow instructions. Before moving to the second technique, there is something important to remember. Health information only helps if people actually hear it before they need it. Many emergencies happen because someone never learned the right response until it was too late. If you value simple, practical health information that explains what to do before a crisis happens, sharing this kind of knowledge with others can genuinely make a difference. Sometimes a few minutes of preparation can protect years of someone's life. Now, once the call has been made, the next step focuses on the second major factor, the blood clot that is blocking the artery. The second technique involves aspirin. If it is available, and if you are able to safely take it, chewing a regular aspirin may help during a suspected heart attack. But there is a very important order here. The call comes first. Aspirin does not replace emergency care. It is not a treatment you use instead of getting medical help. It is a temporary action that may help while professional treatment is on the way. To understand why aspirin matters, remember what is happening inside the artery. The blockage is usually caused by a blood clot, and that clot is not always a finished object that simply sits there. The process can continue as more platelets gather together. Platelets are tiny blood cells with one main purpose: helping your body stop bleeding. Normally, that is exactly what you want. But during a heart attack, those platelets are gathering in the wrong place. They are making the blockage larger and restricting blood flow even more. Aspirin works by making platelets less likely to stick together. It does not dissolve the clot, but it can slow down the growth of the blockage and reduce further damage while you are waiting for treatment. The evidence supporting aspirin in heart attacks has existed for decades. One major study, known as ISIS-2 and published in the medical journal The Lancet in 1988, found that aspirin significantly reduced the risk of death when given during a heart attack. That is why emergency dispatchers often ask whether aspirin is available. The usual recommendation, when appropriate, is a regular strength aspirin tablet or an equivalent amount of low-dose aspirin. The important part is that it is chewed rather than swallowed whole. Chewing allows the medication to enter the bloodstream faster, and during a heart attack, speed matters. However, this is where people must be careful. Aspirin is not safe for everyone. You should not take it if you have a known aspirin allergy. You should be cautious if you have certain bleeding conditions, an active stomach ulcer, or if you have been prescribed certain blood-thinning medications. If you are uncertain, the emergency dispatcher can help guide you. That is exactly why you call first. And there is one mistake I want to make absolutely clear. Do not take aspirin and then decide to wait and see if the problem improves. That is dangerous. Aspirin may buy some time. It does not reopen the artery. It does not replace emergency treatment. The ambulance and the hospital are what address the actual blockage. So remember the sequence. First, call emergency services. Second, if advised and if you have no reason you cannot take it, chew aspirin. Third, prepare yourself for the next step. Because the third technique focuses on something people often underestimate, reducing the workload on a heart that is already under stress. When part of your heart is starving for oxygen, your instinct may be to move around, search for help, walk outside, or try to push through the discomfort. But that is exactly the opposite of what your heart needs. Your heart is already working with a limited oxygen supply. The more you move, the more your heart rate rises. The faster your heart beats, the more oxygen it demands. But the blocked artery cannot deliver enough oxygen. It is like asking an engine to work harder while cutting off the fuel supply. The heart simply cannot win that battle. That is why the third technique is to stop everything. Sit down. Stay still. Reduce the pressure on your heart. When a heart attack begins, one of the most important things you can do is the thing that feels the least natural. You have to stop. You have to resist the urge to walk around, search for answers, or convince yourself that you can handle it on your own. In that moment, your body is already fighting a serious battle, and your job is to make that battle easier, not harder. The third technique directly targets the final factor that determines how much damage your heart experiences, how hard your heart is being forced to work while it is already struggling for oxygen. Think about what is happening inside your chest. A portion of your heart muscle is not receiving enough blood because an artery is blocked. The supply line has been reduced, but your heart still has to keep beating. Now add movement, stress, fear, and panic, and your heart responds the only way it knows how. It beats faster and harder. But every stronger heartbeat requires more oxygen, and the heart cannot get the oxygen it needs because the artery is blocked. That is why, the moment you suspect a heart attack, you should stop whatever you are doing and move into a position where your body can rest. For many people, the best position is sitting down and leaning back slightly. You want to be somewhere safe, somewhere you will not injure yourself if you become dizzy or weak. If you are struggling to breathe, sitting upright is often more comfortable than lying completely flat. Loosen anything that feels restrictive. A tight collar, a belt, or clothing pressing against your chest can make you feel even more uncomfortable. Then focus on slow, controlled breathing. Breathe in calmly. Breathe out slowly. This may sound too simple, especially during something frightening, but it has a purpose. Fear creates a powerful stress response inside the body. Your brain releases hormones that increase your heart rate and raise your blood pressure. That reaction is useful when you need to escape danger, but during a heart attack, it puts additional strain on an already injured heart. Slow breathing does not fix the blocked artery. It does not replace medical treatment, but it can help reduce the extra stress your body is creating while you wait for help. If someone is with you, their role is important. They should stay close, keep you calm, and help you avoid unnecessary movement. They should not tell you to walk around. They should not tell you to wait and see. They should not dismiss your symptoms because you look okay. Many heart attack patients are still awake and able to talk. That does not mean the situation is safe. If you are alone, there is one small but extremely valuable thing you can do before sitting down. Unlock the door. Move to a place near the entrance if you can do so safely. Unlock the door, and then sit down. This simple action can make a major difference. Emergency responders may arrive quickly, but if you become unconscious and the door is locked, valuable time can be lost while they try to reach you. It is a small preparation step that most people never consider. Now, there is another dangerous piece of advice that has circulated online for years, and I want to address it because people continue to ask about it. You may have heard of something called cough CPR. The idea behind it is that if you think you are having a heart attack while alone, you should repeatedly cough in a certain way to keep yourself alive. This sounds convincing because it gives people a feeling of control during a frightening moment. But the problem is that it is not a proven method for someone experiencing a heart attack alone. It does not replace emergency care, and spending time trying techniques like this can delay the one action that actually matters most: calling for help. When people are scared, they often search for anything that gives them a sense that they are doing something. But the best action is usually the simplest one: call, sit, stay calm. Wait for trained professionals. Now let's talk about another situation, because one day you may not be the person experiencing the symptoms. You may be the person standing beside someone who suddenly collapses. The response changes completely. If someone becomes unconscious, does not respond when you speak to them, and is not breathing normally, you are no longer dealing with a person who can explain their symptoms. You are dealing with cardiac arrest. And in that moment, your actions can literally determine whether that person survives. You do not need to be a doctor. You do not need years of medical training. You only need to remember two things. First, call emergency services immediately. Put the phone on speaker if you are alone so your hands are free. If other people are nearby, point to someone directly and tell them to call. Do not simply shout, "Someone call." People often assume someone else will do it. Second, start chest compressions. This is hands-only CPR. Place the heel of one hand in the center of the person's chest. Place your other hand on top. Lock your elbows and push down firmly and quickly. The goal is around 2 compressions every second. It should feel like hard work because it is. You are manually doing what their heart is no longer able to do. Every compression pushes blood through the body and helps keep oxygen reaching the brain and other vital organs until advanced medical help arrives. Many people hesitate because they are afraid of hurting the person. They worry they will break ribs. They worry they will do something wrong. But in cardiac arrest, the danger is not from performing CPR incorrectly. The danger is from doing nothing. Immediate CPR from a bystander can greatly improve a person's chance of survival. And if an automated external defibrillator, or AED, is nearby, use it. You have probably seen these devices in public places like airports, gyms, schools, and shopping centers. They are designed so ordinary people can use them. The machine gives clear voice instructions, it analyzes the heart rhythm, and it only delivers a shock when one is actually needed. You do not have to be afraid of using it. In cardiac arrest, action matters more than perfection. Now I want to return to something that is often overlooked. The people who survive heart emergencies best are usually not the people who know the most medical information. They are often the people who prepared before the emergency happened. Preparation turns panic into action. There are a few simple things you can do today that may help you or someone you love in the future. First, know where basic emergency supplies are in your home. If aspirin is appropriate for you and your doctor has not told you to avoid it, make sure you and the people around you know where it is stored. Imagine waking up in the middle of the night with symptoms. You do not want to search through cabinets while frightened and uncomfortable. You want to know exactly where things are. Second, make sure your home address is easy to see from the street. Emergency responders need to find you quickly. A hidden or unclear house number can waste valuable moments. Third, if you already have heart disease or other medical conditions, keep your medication list and important health information organized. You do not want family members searching through papers while an emergency is happening. And finally, talk about this plan with the people closest to you. Tell your spouse, tell your family, tell the people who spend time with you. Because emergencies are not the time to start learning what to do. The best time to prepare is before anything happens. The truth is that most people think they will know what to do when the moment comes. But fear changes the way people think. A person who has never discussed a plan may hesitate. They may wait. They may convince themselves it is not serious. A person who already knows the steps has something powerful on their side, confidence. And that confidence can save time. So let me make this plan as simple as possible. If you or someone near you experiences chest pressure, unusual discomfort, shortness of breath, sweating, nausea, or symptoms that feel wrong and do not go away, remember the order. First, call emergency services immediately. Second, if aspirin is available and you have no reason you cannot take it, follow emergency guidance and chew it. Third, stop moving, sit down, stay calm, unlock the door if you are alone, and wait for help. And if someone collapses, becomes unresponsive, and is not breathing normally, remember that situation is different. Call emergency services. Start hands-only CPR. Use an AED if one is available. Do not wait for someone else to act. Because in that moment, you are the help that person has. Now let me bring you back to Howard, because his story is the reason this information matters so much. I told you about a man who had symptoms in the early morning hours, who felt something was wrong, but waited because it did not look like the heart attacks he had seen in movies. He survived, but the delay changed the rest of his life. But I also told you about another person who faced almost the exact same situation and had a completely different outcome. Her name, for privacy, I will call Lorraine. Lorraine was 64 years old. She was living a normal life, taking care of her family, enjoying her routine, and doing the things that gave her purpose. One morning, she woke up with a strange heaviness in her chest. It was not the dramatic pain people imagine when they think of a heart attack. It was pressure, a feeling that something was not right. She also noticed some nausea and an uncomfortable sensation in her jaw. The symptoms were easy to dismiss. She could have told herself it was stress. She could have blamed something she ate. She could have waited to see if it disappeared. But Lorraine remembered something important. She remembered that heart attacks do not always announce themselves the way movies show them. She understood that waiting was not a safe choice. So instead of sitting there hoping the feeling would pass, she told her husband to call emergency services immediately and clearly explain that they suspected a heart attack. Those words mattered. While the call was happening, she followed the instructions given to her. She took aspirin when advised, sat down, and avoided unnecessary movement. She unlocked the door so the emergency team could reach her without delay. She focused on staying calm. She controlled her breathing. She waited. A few minutes later, the paramedics arrived. They were able to begin evaluating her immediately. They had the information they needed. The hospital was prepared before she even arrived. Her artery was reopened within the critical treatment window. And the result was something every doctor hopes to see. Lorraine walked out of the hospital with most of her heart muscles still healthy. The last time I heard about her, she was back in her garden, enjoying the simple things she loved. Now think about those two stories. Howard and Lorraine. Two people. Similar age, similar warning signs, similar medical emergency, but completely different outcomes. The difference was not that one person deserved to survive more than the other. It was not because one person was lucky and the other was unlucky. The difference was action. The difference was the first few minutes. One person waited for certainty. The other person acted when something felt wrong. And that is the lesson I want you to remember. You cannot control every factor that affects your heart. You cannot change your genetics in one day. You cannot erase years of unhealthy habits overnight. You cannot predict every medical emergency that may come your way. But you can control what happens after the warning signs begin. Those first minutes belong to you. The decision to call. The decision not to drive yourself. The decision to follow instructions. The decision to sit down and protect your heart while help is coming. Those choices matter. Many people believe that emergencies are won inside hospitals. And yes, hospitals save countless lives every day. Modern medicine has incredible tools, treatments, and technology. But sometimes the most important decision happens before the ambulance arrives. It happens when someone recognizes the danger and chooses not to ignore it. It happens when someone says, "Something is wrong and I need help." That single decision can protect years of life. So I want you to remember this plan one more time. If you experience chest pressure, unusual discomfort, shortness of breath, cold sweating, nausea, dizziness, or a feeling that something is seriously wrong, do not wait for the movie version of a heart attack. A heart attack does not need to look dramatic to be dangerous. The first step is always to call emergency services. Do not wait to see if it improves. Do not drive yourself. Do not worry about embarrassing yourself. Your life is more important than a moment of hesitation. Tell the dispatcher clearly, "I think I am having a heart attack." Then follow their instructions. If aspirin is appropriate for you and emergency personnel advise it, take it as directed. Remember that aspirin is not the solution by itself. It is simply one tool that may help while professional treatment is on the way. Then do the third thing. Stop. Sit down. Stay as calm as possible. Reduce the workload on your heart. Unlock the door if you are alone. Make it easier for help to reach you. And if the person beside you collapses and is not breathing normally, remember that you are no longer dealing with a typical heart attack situation. You are dealing with cardiac arrest. Call emergency services. Put the phone on speaker. Start chest compressions immediately. Push hard and fast in the center of the chest. Do not wait for someone more qualified. Do not assume someone else will act. In that moment, your willingness to help may be the reason that person survives. The most important thing about emergencies is not knowing every medical detail. It is knowing the few actions that matter most. A simple plan remembered at the right time can overcome fear. It can replace confusion with confidence. It can turn a frightening moment into a moment of action. So tonight, before you forget this information, take a few minutes to prepare. Talk to the people you love. Make sure they know the warning signs. Make sure they know what you would want them to do. Know where important medications and medical information are located. Make sure emergency responders can find your home quickly. These small steps may seem unnecessary today, but emergencies do not announce themselves before arriving. The best time to prepare is always before you need the plan. Your heart works every second of every day to keep you alive. It beats when you sleep. It beats when you work. It beats through every moment of your life without asking for anything in return. The least we can do is understand how to protect it when something goes wrong. Remember this: time is muscle. The faster you act, the more heart you may save. Do not wait for the dramatic signs you have seen on television. Listen to your body. Trust the warning signs. And when something feels wrong, take action. Because those first minutes are not just minutes. They can be the difference between losing a part of your heart and protecting the life ahead of you. I'm Dr. John Meyers. Thank you for watching. Take care of yourself, take care of the people around you, and share this information with someone who may need it one day. Because the person who needs to hear this most may not know it yet.